Um, Cervical cancer has a very good screening tool. No? Way back it was PAPS. It's PAP smear, and it's meant for people, for women with no symptoms. You're supposed to catch. It's a screening method, so you're supposed to be asymptomatic. So when you already have watery vaginal discharge or abnormal bleeding, then it's no longer a screening tool. And maybe there is low awareness among our women. They do not go to their doctors. And one more thing, even if there is a, let's say, a screening tool like pap smear or even visual inspection with acetic acid, they are not foolproof tests. No, the false negative rates are high. We heard from the women earlier, the survivors, they had pap smears in the past, but it wasn't able to catch the disease early.
Is stigma also a factor?
I would say yes.
Kasi, syempre, sa masilang bahagi ng katawan ng babae, mas masela ba infected yun sa breast? Pwede pang makapain, and it's more talked about.
And because we know the nature of the disease, human papillomavirus is sexually acquired, so there is really some sort of stigma maybe that accompanies the diagnosis.
Dr. Erwin, what causes, well, we've heard before, or earlier rather, what causes cervical cancer, but can you expound on that?
Well, cervical cancer is 90%, more than 90% is caused by the human papillomavirus.
Ano ba itong virus?
So it's a virus, it's an infection, right? And in addition to what Dr. Anatol has mentioned a while ago, the problem, or the challenge that we are having with cervical cancer is yung stigma. You're correct, no? Because it's sexually acquired. It's sexually acquired. That's why medyo hindi siya nadi-discuss. No? But what we would like to emphasize here is that the mode of transmission is very common. I think that is one thing that we need to address, or to everyone to accept at least. No? That the mode of transmission is very common. It's just a virus, yes, it's a virus, but it's not only infection that we are going to have here. This infection can eventually lead into cancer. So if actually, right now, we are actually shying away with the infection, no? Here, pinag-uusapan natin yung human papillomavirus. We have to go directly to its cause, and that is cancer in general, not only cervical cancer. We have also other cancers that are being caused by the HPV. That is, of course, for women, it's vaginal cancer, vulvar cancer. Then for both sexes, anal cancer, or yung oral cancer, which involves both the male and the female. So I think we should really stress on the education regarding what is HPV. This is a very common infection. Everyone can actually have this type of infection, and we cannot really say who are the people who would actually have cancer later on.
You mentioned 90% is caused by the HPV.
Yeah, actually even more than. Of course, there are still studies na still being proven, still to be proven, na pwede kong makuha through sa hereditary maybe, or not necessarily in sexual transmission, but through maybe indirect contact. But I think this is only a small percentage and still being studied. But more than 90%, even 95%, is caused by just a direct contact through sexual transmission.
So the 10%, ewan ko pero naniniwala ang ilan kasi na baka makuha ito sa public restrooms. Is it possible?
Well, we cannot.
That's a 10%.
No.
Virus pero those infected linen, for example, but that's very small. That's very small.
That's still 10%.
Maybe not 10%. Maybe not 10%. And then there's really a non-HPV associated type of cervical cancer, but again, very little, maybe at most 2%.
Okay, but so the question now here is, how do women protect themselves from this kind of cancer?
the vaccination, I leave it to Erwin, but the screening, the one I mentioned earlier, is the one for adult women. So as you've seen earlier, the 70% in the 1970-19 refers to screening. So now and the WHO now recommends HPV DNA testing. So one which is quality assured to be done every 5 years. So now it's no longer yearly, no? So marami sa inyo siguro naalala pa ang pap smear dapat ginagawa taon-taon. Now the recommendation for the average risk woman is every 3 years, even for pap smear. And for HPV testing, if you get a negative result, it's 5. You repeat it after 5 years, starting at the age of 30.
So from 30 years old, screening.
Yes.
Okay. Pero sasabihin ng marami, wala naman nararamdaman naman. Wala naman ako masyadong sexual contact.
Exactly. Exactly. That's why it's a screening tool, because you're asymptomatic. So these are for healthy women. It's no longer screening when you already have the symptoms.
Okay. Dr. Erwin, let's talk about vaccination. That's one way to prevent this kind of cancer.
Yes.
Tell us about that.
Yeah, and that's what we call the form of primary prevention. Of course, as forms, number one is education. We should be really aware. We should be ready to discuss these things. That these are common, a common form of transmission. We should be able to discuss this with our children. They should be given the information regarding how to prevent it, number one. And then number two, of course, as a form of primary prevention is also vaccination. Because yung mode of transmission, as I mentioned, is very common, so all of us should be protected. It is said in studies that every individual has a chance of getting this type of infection, at least one strain in their lifetime. However, we really cannot say if the strain that as a person who can become sexually active is cancer-causing or not. So that's the primary prevention. That's why papasok po yung secondary prevention, and that is screening, of course. And we do screening, just to reiterate what Dr. Regine has mentioned, that we really do screening for asymptomatic. Ginagawa ko yun na wala talagang simptomas. And that is form of early detection. So that everything that will not be prevented perhaps by the vaccine, you can identify it early through screening.
What if our cancer survivors mention mahal ang pagpapavax? What is the average cost now of vaccine to prevent this cancer?
Well, at least in private practice, we have it per shot is around between 5 to 10,000. It depends on the type of vaccine. And of course, there's a certain population that will receive only 2 doses. And 50 years old and above, they have to receive 3 doses. So in a way, that's also part of a strategy. If you want to vaccinate more, then you have to give the vaccines at an earlier age.
We'll talk about funding later kasi pag naiisip ko yung 5 to 10,000, kalahating buwan na itong sweldo ng marami po natin mga households, di ba?
Well, but of course, we have to compare it. No? We have to compare it later on if you have this only a suspicion, like in that case, ng ating mga patients a while ago who survivors. Again, the symptom is very common also. Una nga, di ba na they thought it was just a symptom of perimenopause. So, most often they are neglected or nade-delay yung suspicion because even the symptoms are the same as that of any other disease. So, in the end, suspicion pa lang, yung request for a lot of tests already, and cancer, cervical cancer is still one of the differentials. Ibig sabihin na, isa pa rin po yun na we need to confirm if na dapat hindi sana cancer.
So you're telling us, mas maigi na yung 5 to 10,000 sa shot kaysa sa 100 to 1 million pataas ang gagastusin. Tanungin natin mamaya si Sir Cruna tungkol sa funding ng gobyerno. As far as the Senate is concerned, Senator Bongo's office is concerned.